Hello again. We continue to discuss about dermatology and start from special part body and some disease according to stratum, different stratum and connective tissue. Skin, refresh your memory about anatomy structure skin. Stratum corneum, stratum lucidum, granulosum, stratum spinosum, basilae, and derma, and hypoderma, and structure, amphibitic structure into the dermis, a lot of supply nevoc, sebaceous glands, which glands have follicles, a lot of nerves ending, and so on. Merkel cells, the special cells into the skin. They are at highest density on the fingertips and lips, face, where touch sensation is most acute. Merkel cells carcinoma is a rare type of skin cancer that usually appears flesh-colored or bluish-red nodules. Sometimes it's redness and violet color. Basal cell carcinoma. Basal cell carcinoma are abnormal, uncontrolled growth of lesions that arise in skin basal cells, which link the deepest layer of the epidermis, the outermost layer of the skin. Basal cells carcinoma often look like open sores, red patches, pink growths, shiny bumps on scars are usually caused by a combination of cumulative and intense. Occasionally sun exposure areas. It's growing to horizontal lay, formation a lot of part destroyed, very rare, take metastasis. Melanin metabolism is important now about them and different melanin present into the epidermis dependent on the melanin biochemical reaction. Eumelanin or pheomelanin may be formed. Eumelanin, this black or brown pigment, is the most abundant type of melanin in humans. A higher abundance of eumelanin is usually the main reason why patients seek skin brightening treatment or suffer with areas of hyperpigmentation. Pheomelanin is red yellow pigment found both in lighter skinned humans and darker skinned humans. In the presence of glutathione, pheomelanin, the red-yellow pigment, is formed instead of eumelanin, therefore providing us with the natural skin lightening effect we see with 4-glutathione. This depends for present enzyme separated to different way production melanin. Melanin start production from amino acid, essential amino acid, tyrosine, and formation dopamine, and dopamine take by different enzyme, dopa-tautomerase or glutathione. People have genetically different enzyme. For example, Asian people more higher have glutathione enzyme, and the resultant have different color in human. And African American people have more this enzyme, and European people have more as eumelanins. And combined between this melanin formation, different color skin and different ethnic groups people. This picture asks us about albinism, this autoimmune genetic disease where totally absent melanin present only in true epidermis, resulted absent melanocytes and not production melanin. It's absent not as a human's problem, it's sometimes discovered between a lot of animals. Another disease, vitiligo. Vitiligo, this autoimmune disorder about take our autoantibody against production melanin. The start present from distant areas, the body, extremities, face, and sometimes a lot have animal too. And this patch grown to at time to proximally part of the body. Autoimmune associated vitiligo with sometimes associated with autoimmune and inflammatory disorder and another disease such as Hashimoto thyroiditis, scleroderma, rheumatoid arthritis, diabetes type 1, diabetes mellitus, psoriasis, Addison disease, pernicious anemia or B12 anemia, alopecia areata, systemic lupus erythematosus, and celiac disease accompanied vitiligo. And so if people have patches, discolorated patches, you need to discover it in examination for present in other signs and other autoimmune disorder. Stratum spinosum, we discussed about them. The stratum spinosum prickle cells layer is characterized by prominent intercellular bridges that are desmosomal attachment between cells, Langerhans cells. Pemphigus vulgaris, its disease. Pemphigus is autoimmune disease caused by antibodies direction against both desmoglein 1 and desmoglein 3 present in the desmosomes. Loss of desmosomes result in loss of cohesion between keratinocytes in the epidermis and a disruption of the barrier function served by intact skin. The process is classified as a type 2 hypersensitivity reaction in which antibodies bind to antigens on the body's own tissues. Transudative fluid accumulates in between the keratinocytes and the basal layer, suprabasal split, forming a blister and resulting in what is known as a positive Nikolsky sign. The gold standard for diagnosis is a punch biopsy from the area around the lesions that is examined by direct immunofluorescence staining in which cells are acantholytic, this lacking the normal intercellular connection that holds them together. This can also be seen and known as a Tsang-Smith. Its clinical look as acantholysis disease or connective disease, Pemphigus vulgaris. A lot of clinically we can say a lot of erosion. This very large areas have it. All type of skin, if you look like, is intact areas. If you scratch this normal skin, formation blister too, because antibody production and deposition all types the body. And this histological picture about split between layers, epidermis, stratum spinosum, from stratum granulosum and between stratum basilae. This people treatment, standard treatment, use all lifetime glucocorticoid as an immunosuppressant and immunocompromised disease. Next, stratum granulosum. Stratum granulosum of keratinocyte is characterized by the accumulation of keratin, called keratinization. The cell of the stratum granulosum accumulate dense basophilic keratinocyte granules. Seen of the close-up view of these granules contained lipids, which, along with the desmosomal connections, help to form a waterproof barrier that functions to prevent fluid loss from the body. And people with hypergranulosis lay special disease called lichen rubelplanus or lichen planus clinically look like as formation a lot of papilla in favorite part of the body, wrist, palm, and in other type, and involve mucous membrane too. This picture asks us about genetic disorder, genetic disease. It's called ichthyosis. It's a problem with keratinization and hornulae. These have different stages of this disease, from light disease to very dangerous and not survive, not junction with life. Problem with not only with skin, eye too, and mucous membrane too. Papillary layer. Papillary layer is made of loose areolar connective tissue, which means collagen and elastic fiber of the layer from a loose mesh. This superficial layer of the dermis project into the stratum basal of the epidermis to form fingy-like dermal papilla. Within the papillary layer are fibroblast, a small number of fat cells, adipocytes, and an abundance of small blood vessels. In addition, the papillary layer contained phagocytes, defensive cells that help fight bacteria or other infections that have breached the skin. These layers contained lymphatic capillaries, nerve fiber, and torch receptor called the Meissner corpuscles. It's estimated that 1 in 10 people have a connective tissue disorder. Diseases of connective tissue include connective tissue neoplasia, including sarcoma such as hemangiopericytoma and malignant peripheral nerve sheath tumor in nerve tissue called Reckling-Gauss disease or neurofibromatosis. And this next picture asking about hemangiopericytoma, its formation nodules, skin, mucous membrane, and these nodules growing a lot of before a large size. And next about malignant, not malignant peripheral nerve sheath tumor, Reckling-Gauss disease or neurofibromatosis. This formation nodules, parch, and destroyed parts of the body. Neurofibromatosis is a group of 3 conditions in which a tumor grows in the nerve system. The 3 types are neurofibromatosis type 1, neuromatosis type 2, and schwannomatosis. In neurofibromatosis 1, symptoms include light brown spots on the skin, freckles in the armpits and groin, small bumps with the nose, and scoliosis. In neurofibromatosis too, there may be hearing loss, cataracts at a young age, balance problems, flesh-colored skin flaps, and muscles wasting, atrophy muscles. The tumors are generally non-cancerous. It's benign tumor. Marfan syndrome is also a connective tissue disorder. Marfan syndrome is genetic disorder of the connective tissue. The degree to which people are affected varies. People with Marfan tend to be tall and thin, with long arms and legs, fingers, and toes. They also typically have flexible joints and scoliosis. The most serious complication involves the heart and aorta, with the increasing risk of mitral valves prolapse and aortic aneurysm. Other commonly affected areas include the lungs, eyes, bones, and covering of the spinal cord. Marfan's congenital disease and syndrome, Ehlers-Danlos syndrome, is look like that, Ehlers-Danlos syndrome. Formation more large and more number elastic fiber. Normally ratio between collagen formation collagen and elastin fiber between them approximately 95% fibroblast production collagen and 5% up to 5% production elastin, this elastin fiber. More production elastin fiber is a genetic problem of formation production fibroblast. It's called Ehlers-Danlos signs. Sometimes people participate in show and ask about this is talent. It's not talent, it's present only as a genetic disorder. Fibroblast. Very important cells lay into the connective tissue, all connective tissue, where this lay not only skin, another organ too. Fibroblasts make collagen, glycosaminoglycans, reticular and elastic fibers, glycoproteins and cytokine. Tissue damage stimulate fibrocytes and induced the mitosis of fibroblast. This resulting after injury, replaying this place injury formation scar. The lifespan of the fibroblast, as measured in the chick embryos, is 57 to plus minus 3 days. Amino acid, it's an essential amino acid necessary to production collagen and other fibers. It's glycine, proline, and lysine, and very important vitamin C too. Sensory receptors in the skins are cutaneous mechanoreceptors, Ruffinian's organ skin stage, and the bulbs of Krause, it's called receptor. Meissner corpuscles, changes in texture, slow vibration. Pacini corpuscles, reflected deep pressure, fast vibration. Merkel's disc, sustained touch and pressure. Fresnel's engines, thermoreceptor, nociceptor, chemoreceptor. There's a lot of number receptor to skin because skin covered and separate into our body from environment. This picture display about structure, basement membrane, very important tissue that junction between epidermis and dermis. Basement membrane have three lamina: lamina lucida, lamina densa, reticular lamina. Lamina lucida, lamina densa, it's connect with basal lamina as epidermis, and reticular lamina, a connection between reticular connective tissue. Next picture ask about disease developed with problem lamina basement membrane. A group of disease stemmed from improper function of basement membrane zone are united under the name Epidermolysis bullosa, formation bulla, and desquamation superficial skin. It's not recover, have a lot of erosion. It's very difficult disorder from children. It's not long time life have this children, and accompanied for infection. It have a short time life. This picture discovered about hair follicles. Hair follicles have a shaft, dermis, epidermis connected between them, and lay very deep to reticular layer up to hypodermis. Have hair papilla, hair bulbs, hair follicles, sebaceous glands. It involves the hair follicles as a hair sebaceous unit, erector pili muscles, and have hair medulla, hair cortex, cuticle, and inner root sheath, outer root sheath, and connective tissue sheath. This picture displayed about regrowing hair. This process continued a lot of time life and depend on stage growing hair. Anagen stage, it's discovered about hair growing, and this follicle have a bulb, supply nutrition, and growing hair follicles. And in the next stage, telogen stage, it stopped to supply nutrition into the bulb, and this is hair follicles pass upward to superficial skin, and hair follicles something flexible and easy pull off from hair follicles, and after this hair loss. And rest stage, catogen stage. After this stage, maybe 3-4 weeks approximately loss, and after this regrowing bulb, formation new nutrition, new capillary restorer, and formation new stage anagen. This is cycles continue all of time. Disease accompanied with hair loss. There are a lot of autoimmune disease, intoxication after severe disease, maybe hair loss, and this is called alopecia. This picture ask about problem with sebaceous glands. We continue this topic next lectures, and this picture discovered about problem with sweat glands. Sweat glands, if it's have infected, formation apocrine sweat glands, localized special areas, axillary layer and groin layer, formation hyperhidrosis disease. This treatment surgical treatment about drainage these areas and prescribed antibiotics. Thank you for attention. See you next lectures.